Hello, welcome. Today we are going to discuss hematospermia, semen hematospermia. In other words, we call it blood in your semen. Many a times you see blood after you have ejaculated. You see that there is some reddish brown bloody substance in your semen. After ejaculation, some men see blood in their semen. Yeah, it calls for a worry. Yeah, you'll be worried. You will see why there should be blood in my semen. After sex or whatever, you look and you see blood in your semen. Your semen looks bloody. Don't worry. Today we are going to discuss so that we enlighten ourselves, we educate ourselves more on that particular condition. When you see blood in your semen, there is a treatment or there is a way we are going to discuss. We educate ourselves. We know more about it. You see, often than not, a lot of men see blood in their semen, they become worried. It's one of the real conditions. It is not common in the system. It's not common, but people do have it. The moment we see blood in our semen, when we ejaculate, we see blood. It indicates there is a problem. Blood in our semen naturally doesn't actually indicate a bigger or a danger in our system or on our body, but if you feel you don't have any explanation, there's no unexplained factors to you having blood in your semen, you can equally check and see your doctor as soon as possible. So during or after ejaculation, you see that there is some little blood or some blood in your semen, and what we are saying is you will see it to be very pink in color, reddish brown or bright red. The blood will be bright red, sometimes reddish brown, sometimes pink in color. As a young adult, when you are in good health and you experience it, there's no need to worry. However, even though in most cases the cause is relatively minor and the cause is not, most of the time is temporal, never ignore it. In most cases, we are saying that it is temporal. Maybe it may come and go. You will not have it continuously, but you having it temporarily doesn't also mean that you shouldn't see a doctor. Never ignore it, because in small chance, there's a small chance that you seeing semen, bloody semen, you seeing blood in your semen can indicate, or there's an indication that there is a chance of you having a prostate cancer, a very small chance of you having a prostate cancer or a testicular cancer. So to help us understand the situation better, blood in the semen, what are the common cause? There is a particular cause or major cause of seeing blood in our semen after ejaculation or after expelling or semen coming out. You see that there will be blood in it. What is the major common? 90% of the cases of this particular case is caused by sexual activity. This is due to the rupturing of the blood vessels, which can occur during any form of sex, whether masturbation or any type of penetrative sex. You know, for you to have an erection, the blood vessels must be engorged, must be filled with blood so that you can have a good erection. And what we are saying here is, during sexual activity, there may be a rupture in the blood vessels. There can be a rupture in the blood vessels. The moment there is rupture in the blood vessels, when the part through which the blood flows to engorge the penis or to engorge your penis to have a full and harder erection, when these blood vessels rupture, they may end up producing blood, or blood may be found in the semen that you are producing or you are bringing out. That's after ejaculation. So one of the main causes, that's 90% of the causes that will let you see blood in your semen after ejaculation, is rupturing of blood vessels during sexual activity. And this sexual activity can be either penetrative sex or oral sex. That's any form of sex, during masturbation or anything. It can cause the rupturing of the blood vessels, and this can lead to blood in your semen. So as I said, 90% of the causes may be as a result of sexual activity. So the other 10%, let's explain more. The other 10%, the 10% factor that may lead to blood in semen. Let's answer some of the questions. Some people are asking some questions that, can prostate cancer cause blood in our semen? Can prostate cancer cause blood in our semen? We are saying that when we talk about prostate cancer, or let's say prostatitis, it is the inflammation of the prostate gland. So when your prostate, that's the gland between your bladder and the penis, which produces part of our semen. So you see, when during ejaculation, or if the body is producing semen, the sperm is produced in the testicles. Then when it reaches the prostate, it is filled with the prostate fluid, the juice. They say the gland produces some fluid so that it will allow the sperms to swim. So when this gland, that's the prostate, is inflamed, there's a condition we call prostatitis. When it's inflamed, it will affect its function. You see, it becomes infected. So any condition that may affect the gland to malfunction can also end up, there's a slight chance that when the gland is inflamed, there's a slight chance that when the prostate gland is inflamed, there may be a slight cause of you seeing blood in your semen, because it becomes infected and engulfed, inflamed, and this can lead to production of blood after your semen, because it is the gland that produces some fluid to mix with the sperms for you to see a semen. So when the gland is inflamed, or when there is some infection, or when there is an enlargement or engorgement of the gland, it can or may cause blood in your semen. So can UTI cause blood in semen? Yes, potentially yes. Having UTI actually means there's something wrong with the system. A healthy man will not have UTI, that's urinary tract infection. Your urinary tract will not be infected when you have, or you are healthy. So for you to have UTI, there's high possibility that you having blood in your semen, the UTI can be a causative factor. So you having UTI can potentially, or can be one of the causes of you having blood in your semen after ejaculation. Especially when you are over 30 years, it is important that you get checked by a doctor. As a man, you having UTI can potentially cause you to have blood in your semen, that's after ejaculation. People may ask, is the only UTI that can cause blood in semen? No, there are other types of infections that may also cause blood in semen. For example, that's the STIs. So all these signs or conditions can cause blood in your semen. All these conditions can cause blood. That's the gonorrhea, the syphilis, the chlamydia, the epididymitis. Since they are also affecting your organ, they can also cause blood in your semen. So somebody may ask, can hernia cause blood in semen? No. Typically, no. The tract through which semen production or semen being produced passes is different from hernia. Hernia never directly affect the tubes that produce semen. Hernia never directly affect the tubes that produce semen. But what they can do is, it can press against the region, the organ area. Yeah, is an organ or a section of a tissue that has pushed through from its place to a weaker spot or a weaker surrounding. So when a tissue finds itself in an area which is very weak, so in the origin or that region, it finds an area which is very weak, and the tissue pushes itself through that weak area, and it develops. Since it has found its place there, it has found room, it developed. So when it comes to it having effect on you having, or it being a causative factor of you seeing blood in your semen, it is not a contributing factor. It doesn't cause us to see blood in our semen. Hernia doesn't cause us to see, but what it can do, it pushes, it presses, it brings pressure on the area, but it doesn't actually cause us to have blood in our semen. You may ask, so if I have kidney stones or any kidney related issue, am I also going to see blood in my semen? No. You know, the kidney stones and all the kidney related problems deals with the kidney, the bladder, the ureter, and the urethra. So if it's about the urine or the kidney, it has its own part, as I stated earlier on. But it doesn't have anything to do with you having blood with your test in your semen, because blood in semen is with the testicles and the prostates and the glands and stuff. So you having a kidney related problem, let's say kidney stones or whatever, will not cause you to have blood in your semen. So today we discuss the possible ways of you seeing blood in your semen. You are saying the blood in semen is one of the real conditions that you can have, but if you should do have, or in case you should experience one, you have to see a doctor for it, especially when you are over 30 years old, especially when you're over 30 years old. And secondly, however, in as much as we are saying that you should see, it is not also a condition that we should be worried about, because as an younger adult, it's normal to have it once and it's okay. But there is the need for you to see a medical doctor or see a physician, especially when you cannot explain the causes of you seeing semen in your blood. We also elaborated on some of the questions that people ask. Some people are asking, can I see blood in my semen when I have kidney stones? We said no. With kidney related problems, you don't need to. There is no need that way that you are going to see blood in your semen, because the kidneys or the kidney tract, the urinary tract, the ureter and the bladder are totally different from the testicular tract and the semen tract. We also asked that, can hernia cause blood in semen? We also said no. Hernia problems and hernias are different, you see, from you having blood in your semen. And we asked that, can UTI also cause us to have blood in semen? We said yes. UTI can be a slight causative factor of you seeing blood in your semen, because when there is an infection in the area, automatically you are going to have inflammations and stuff. So there's high possibility, or there's slight possibility, that you are going to see blood in your semen. We also asked if you having any issue with your prostate, that's the prostatitis, when the prostate is inflamed, are you going to see semen in your blood? We said blood in your semen. We said yes. For you to have prostate, there is a slight chance that, due to painful urination and frequent urge to urinate and stuff, there's slight chance that you are going to see blood in your semen. Today, this is where we end our session. You can also see my video on how to keep the vagina healthy by cleaning it, the proper way of washing and cleaning your vagina. We also have stuff like douching, the myth and misconception about douching. Stay tuned. Don't forget to like, comment and share this video for others to also be educated. This is GN Studios. My name is Village Doctor.